Welcome back, everyone. Steve Kashul, Dr. Brian Cole, Sports Medicine Weekly on this Saturday morning. So happy you're with us. Time now for our Ask the Doctor segment, giving our listeners the opportunity to have Dr. Cole address their specific sports injury issues. Very easy to submit a question. Just go to our website, sportsmedicineweekly.com. On the homepage, you will find a link underneath the photo of Dr. Cole and yours truly on the right side of that homepage. Click on that link and you can submit your question. Question number one for you, Dr. Cole. As a specialist in sports medicine, do you think you will be called to join frontline workers while elective cases are canceled? And if so, what is the learning curve like to refamiliarize with the ICU and critical care?
Well, Steve, certainly if I was called in, I would do it. I would argue, though, I'm probably not the best person to be in the ICU or managing a ventilator at this point in my career. That being said, there's a whole continuum of needs at the hospital side. We now have at least 30 clinicians, both advanced practice providers like physician assistants and doctors volunteering at Rush. And they can do anything from intake to testing to managing non-COVID patients while people are taking off task who are maybe better prepared to work in the ICU or the critical care setting. So warm bodies help here. What's really fascinating and great news in this challenging situation is that the protective measures that are being utilized, which are surgical masks, gowns, and hygiene, and all the basic principles that are embodied in sort of social distancing are actually are very effective in the hospital setting. And there's a surprisingly low incidence of transmission to medical care providers given the actions that are currently taking place. That is a really important thing. And in other countries, early in this problem, there were a number of healthcare providers that turned positive, and now I would tell you that the numbers are very, very low given our understanding of how the virus is transmitted and the protections that we can put in place. So that part is extremely encouraging.
And one more question before we finish out our show for this Saturday, Dr. Cole. Another listener asking you this. It was reported, Dr. Cole, that a few NBA players tested positive for COVID-19. Once recovered, what may be the course of action for these players to return to basketball?
Like any viral illness, it's a big hit on your exercise capacity. And while exercise actually can increase and improve your immune system, this virus, when symptomatic, is a enormous burden on one's immune system. In fact, what happens is that there's this big inflammatory response called there's a terminology that's being used called a cytokine storm, which is basically a frenzy of biologic activity associated with inflammation. So the flip side is that exercise can be beneficial to our immune system, but it can also deteriorate if it's done at super high intensities. So we have to be very careful about how we reintroduce an exercise regimen in an organized fashion to our athletes who have been COVID positive. I will tell you what's interesting is a lot of the athletes who did test positive were not particularly symptomatic. And that's going to be a different program in terms of return to sport than those athletes who were very, very symptomatic and impaired and shut down for a bit. So it's going to be very individualized, but it's not a rapid, very aggressive return. It's a progressive return in an effort to sort of balance the positive and negative impact of high exertion and exercise.
Well, Dr. Cole, we're out of time. Wish you a safe week. We'll talk again next Saturday. And to you and your family, your patients, your coworkers, please stay healthy and safe.
Likewise, Steve.
Many thanks to our producer, Shane Reardon. Also to Mitch Rosen from The Score. Mitch and Shane doing a great job allowing us to continue this show and doing it in a safe environment from our offices via a broadcast app. Our coordinating producer is Tracy Toro. Also want to thank David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Kashul saying so long. Thanks for listening to Sports Medicine Weekly, and we will be back again next Saturday at 8 a.m. Central with a brand new edition of Sports Medicine Weekly only on
670 The Score.